I used to tell my team the sole purpose of what we do is patients. I think the most shocking thing was that we would not provide a life-saving service simply because there was no funding.
When it comes to cardiovascular care on the organizational level, MedAxiom, an ACC company, understands the challenges your program is facing. Welcome to MedAxiom HeartTalk, the podcast where thought leaders come together for one ultimate goal: to continually transform and optimize cardiovascular care for all. MedAxiom HeartTalk starts now.
Hi, everyone, and welcome to MedAxiom HeartTalk. I'm Cheryl Toth, and I'm thrilled to be the new host of the podcast. This episode marks the launch of a new format, and I think you're really going to like it because we're moving things to a more interactive interview-style program, and we'll be featuring a variety of guests. From MedAxiom consultants and members to physicians, thought leaders, and others, we'll get insights on hot topics and emerging trends in CV services and care. And we'll also roll out additional show features over time. I've been working with the MedAxiom team for nearly a year now, developing content for blogs and articles. I'm a course creator, professional development leader, and trainer. And I've spent my entire career in healthcare, primarily working with physicians and practice managers. But enough about me. Our guest today is MedAxiom's newest consultant, Terri McDonald. A nurse and former service line executive, Terri has extensive experience in leading, managing, and optimizing every level of the cardiovascular service line. Hi, Terri. Welcome to Heart Talk, and welcome to MedAxiom.
Hi, Cheryl. Thank you. I'm very happy to be here.
Great. Well, Terri, I know you started your clinical career in cardiac and critical care nursing, and then you went on to work in administration and operations, clinical nursing management in the acute care setting. And you also served in hospital leadership roles for quality and performance improvement, accreditation, utilization and case management, and medical staff services, among other things. If that wasn't already a fine pedigree, just before joining MedAxiom this summer, you spent 8 years as the Heart and Vascular Service Line Administrator in a co-management shared governance model at Tallahassee Memorial Healthcare. I am curious whether you've had any time to sleep in the last 15 years. It's a very impressive resume. So tell me, what inspired you to join MedAxiom?
Well, thanks, Cheryl. I've been blessed with some very incredible opportunities in my career, very diverse experience, as you pointed out. Honestly, I think there are a lot of really hardworking people in CV care that don't get a lot of sleep. So
Probably true.
I'm part of that team at times. So I joined MedAxiom because I want to support advancing cardiology and cardiovascular care. I'm excited about working with CV programs to help them design practical and innovative solutions to the many challenges that they're facing. I'm also excited now about being part of the American College of Cardiology. There are endless resources within the college that are available to the MedAxiom consulting team to use in our work with CV programs across the country.
That's great. I wonder too, where do you see your consulting practice focusing? What kind of projects do you see yourself doing as you support the advancement in cardiology and cardiovascular care? Tell us about that.
Okay, so my expertise really is in integrating CV service line teams. CV programs are facing a lot of challenges now, as they always have. The one thing that's constant in this industry is change. Most cardiology practices now have integrated with healthcare systems, largely due to financial or competitive pressures. And these integrations can be really difficult. True integration should lead us toward achieving the quadruple aim. If you're not familiar with that, the quadruple aim is, number one, optimal patient experience. 2, population health. In this case, it would be CV population health. Mm-hmm. The third aim is reduced cost, and the fourth, which is the newest goal within that quadruple aim, is care team well-being. And some programs are further along toward all those goals than others. My consulting practice will focus on assessing opportunities to facilitate true service line integration but also on meeting smaller challenges in really any area of the CV service line.
Mm-hmm.
Also then learning best practice along the way, which allows our team to share innovative strategies across the country.
Well, and I know we're going to talk a little bit. I've got a few questions for you about that service line integration because you've had some great experience there. But before we do that, I would also like to know, Terri, what do you do for fun? What should we know about Terri the person, not Terri the consultant?
Okay, I am what you see. I have lived in Florida most of my life and have become really a beach person at heart. We get to enjoy the water pretty much all year long. But my husband and I really enjoy traveling. And in our off time right now, we're currently exploring the Mountain West, which is something obviously the polar opposite of the beach.
Yes.
Yeah, I also really enjoy, I'm going to enjoy, I think, the opportunity to travel across the country, visiting CV programs, and also finding new places to visit with my husband.
Great. And I just have to point out, okay, so I live in Tucson, Arizona. So where in the Mountain West have you been, or are you looking to go? Which states?
So, yeah, we love Northern California, Montana, Colorado, Wyoming. We haven't been there yet, but that's one of the places I'd like to visit. We hike and do a lot of sightseeing and just looking at, the different lifestyles in different parts of the country. It's really fun.
Great. It's a good goal because, yeah, like you said, it's very different. Yeah. We've got dry air out here. Although today it's going to be 109 here, so very dry. Very dry and hot.
Yeah.
All right. So travel is definitely in your future for personal and professional reasons because you are going to be out there, out and about, visiting various CV programs in your work with MedAxiom. Let's talk a minute about the recent blog that you wrote this summer for MedAxiom, and we'll put it in the show notes, and it's also on the website. But that's really what this episode's about today, about why you have a passion for CV care. You use the concept of Simon Sinek's "What's Your Why" to tell the story of why you follow the path that you have in patient and CV care. And for those of you who don't know, Simon Sinek is a management guru. He teaches that you have to understand the why behind a product or a service or an idea if you truly want to figure out what inspires people to buy it or what motivates employees to be loyal to the company or the brand. So, and did you know that Simon's TED Talk on that subject was like the third most watched TED Talk?
Wow, I did not, but it's a great TED Talk, and I highly recommend taking the time to view it.
Yeah, it's this, I don't think "What's Your Why" is the title, but you'll find it if you just search Simon Sinek. I looked it up. It's been viewed more than 46 million times, so definitely worth watching. So Terri, tell us about your why. Why did you choose nursing and ultimately CV leadership roles? Tell us about that.
Well, all the work we do in CV services is really for the benefit of the patient. I used to tell my team and my operations team, if there were no patients, we wouldn't be here. The sole purpose of what we do is patients. Mm-hmm. My why, so along that line, my why is actually saving lives. Mm-hmm. I was drawn to nursing from a very young age. My mom was a big influence in my career decision, and I also had a lot of strong role models that were nurses. I think being a nurse is one of the best things you can do. It really is a very fulfilling profession. I highly encourage people, if they're trying to find a first or even a second career, nursing is a great way to go. And then once I was exposed to CV care, I was really hooked. I love every element of cardiology, cardiovascular services, cardiac surgery. Every subspecialty has its own very fascinating focus. But at the core, everything we do, every specialty and subspecialty really is about saving lives. I had incredible opportunities to advance in leadership roles. I had a couple of really great mentors that gave me really great opportunities. I was able to get a diverse experience, mostly in acute care leadership and operations, even during times when I was not solely in cardiovascular services. I was always connected and doing something with the CV service line.
I think that's, I'm impressed because I know I have had the pleasure of working with a lot of former nurses who are now consultants or administrators, and they tear up when they talk about how much they enjoyed, they'll remember a specific patient. In fact, you were telling me once, didn't you have a specific patient that really kind of flipped your switch when you said, what was that story you were telling me about the patient in the ICU?
Yeah, so she was a young woman that had severe cardiomyopathy, and we had, applied a lot of life-saving technology to try and return her to health. And unfortunately, she needed a transplant, but was not insured. And this was probably the first time that I realized that the care that we're providing is very expensive, and funding plays a big role in it. And I think the most shocking thing to me in that was not that it was so expensive, it was that we would not provide a life-saving service to a patient simply because there was no funding. It took me a while to really kind of square that up in my head, and it affected me really substantially. I almost left nursing altogether. I left critical care for a while, and anybody that has worked in critical care knows you're kind of a junkie. So I went back a couple of times before I finally realized that maybe it was time for me to work on the other side of the equation, and that was to work in roles where I could empower nurses to care for patients and try to help eliminate some of the disparities in care that we see due to healthcare economics. As I grew in that understanding, I began to understand more that margins matter. And if we don't have margins, then we can't really focus on trying to eliminate disparities. It's kind of an inverse relationship. So she did go on to pass away. I don't know that she would have survived even if she had received her transplant, but anyway, it impacted me a great deal, and I think there are many nurses in my age range that have probably experienced similar things. Mm-hmm. And I think you can do one of two things. You can get jaded and burned out and walk away, or you can make the decision that you're really going to try to do something to help patients and help everybody on the team remember that what we're doing is about the patient. It's not about margins, it's not about volume. It's about taking care of patients. And to do that, we have to be a team, and we have to decide on collaborative goals so that we're all kind of getting what we need in order to function as a team and focus on the patient as, again, the center of what we do.
It's an incredible story. I mean, you sort of took a lemon and made it into lemonade, which I just love that. And the fact that you still remember and think about that patient, it's got to be sort of a thread for you in the rest of your career. And I think this is a really great segue into talking about this, in order to support the patient fully, there's this great divide, as you called it in your blog, I think, that exists between hospitals and physician practices, and that we've got to work together. And so what do you see as some of the big challenges in doing that, in getting hospitals and physicians practices to work together to serve the patient?
Yeah, there really is a divide, despite our surface integration. We've integrated simply because we're now all a part of the same organization. It doesn't mean that we're all on the same team. And I think, simply stated, the biggest challenge is trust. It's being able to create a trust between physician leaders, administrators, hospital leaders. Regrettably, there's been a traditional distrust in that relationship, and I don't think we can move forward toward the triple aim and making the patient the center of the equation until we're all on the same team. So trust would be, I think, the biggest challenge.
The big one. Well, and what qualities does a practice leader or a hospital executive, hospital leader need to close that divide, to build the trust, to move forward toward the triple aim and, serving patients in this way? What qualities do you see needed?
Yeah, that's a good question. I think you have to have an open mind. You have to have innovative thinking. You have to have collaboration. Both are very, very important. I think you have to have a willingness to leave the status quo of we're two different camps. We're now all on the same team. We do, there are issues that divide us and that we don't agree on, but in order to focus on the patient, let's sit down and address what we can and all become one team. And they have to believe in the quadruple aim. I think that's really important.
Great. Those are really good thoughts. You know what? I think we're going to take a break and we'll be right back with Terri McDonald, and we'll talk a little bit more about how she has been involved in knitting together this patient-centric experience and bringing both sides together. We know that compensation benchmarks are on the minds of many MedAxiom members. Well, great news. MedAxiom's Cardiovascular Provider Comp Survey report is now available. It's one of the most anticipated reports we release each year. It's the gold standard for the cardiovascular industry and an essential strategic planning tool. Use it to optimize your organization and advance cardiovascular care. So get your complimentary copy today. Go to medaxiom.com/comp survey. So we're back with Terri McDonald, MedAxiom's newest consultant and former service line manager, most recently with Tallahassee Memorial Healthcare. And we were talking about this need for the building of trust and, you know, getting practices and hospitals to work together better. Because you mentioned the camps. I mean, I smiled. I'm sure everybody listening in their car or wherever is kind of like, oh yeah, you know, we know that. We've experienced it. How do you get the different camps to collaborate? What's been effective for you?
So definitely it takes a leader or two to get this moving. I think, you know, listening to podcasts like this, or definitely we all read a lot. We're trying to keep up with what's going on in the midst of all this change. There's a lot of things out there. There's a lot of evidence-based resources out there that are telling us you need to collaborate in order to achieve the quadruple aim. So
have you found that, I mean, what's the role of quality and cost data in all of this? You know, you've got everyone at the table, you've got this collaborative leadership, this team, and how does quality and cost data fit into it?
Yeah, that's an excellent point. Thank you. Data are really crucial in understanding what your challenges are and where disparities exist. And when we start to talk about disparities, it's not only in healthcare, but disparities in workflow, work volume, compensation. You know, those data can help us track down where we are not kind of hitting the spot, and sometimes determining where we want to be. This is where we're at. And if we could improve 10%, this is where we would want to be. Mm-hmm. And just, you know, an example of the disparity on the care side, let's say we all agree that we need a wellness or a rehab, or wellness and a rehab program, and that's very crucial in creating a world-class CV program. So how do we collaborate on designing and funding a low-margin program? Because those programs are not, they don't have a lot of margin. It takes a lot of commitment. Quality data then also allow us to benchmark ourselves against best programs and design strategies not to lag behind that and actually become the best program.
Well, and I know that I'm thinking of this program and designing things. You and I have talked about in past conversations how at Tallahassee Memorial, you came up with a way to put together a program or a communication, I guess you could say, that protocol between the hospital and the practice, and how when the patient needed certain aspects of the program, the practice communicated in certain ways, and then they were handed off to the hospital, and that worked really well. Can you share a little bit about what worked there and what you did?
Absolutely. So on the operational side, often you find that the practice is kind of working or they have workflows that work very well for them, and everything is toward a certain goal. That is getting the procedure scheduled, making sure they get pre-auth, you know, all the technical work that goes along with that. The hospital has a different workflow, and it often doesn't correlate with what's going on in the practice side. The practice side is or is not providing education on medications, and the hospital has a different process for that. So how do you stop the madness and put the patient back in the center of that? And basically it is getting teams to the table and saying, okay, hospital pre-admit unit and practice staff team, we are now all on the same team, and we're going to create a flow that works for the patient to make sure that what they hear in the practice is what they hear at the hospital, and then when they get back to the practice, they're hearing the same thing that they heard when they were in the hospital. So there are a lot of opportunities, again, because it's two separate worlds that we're trying to merge, and it's very inelegant, but it, with work and with leadership, you can really overcome those things.
Well, and I love that story because, I mean, that really is, when you think about the communication from the practice team being consistent with the hospital, and the patient's going to come back and see the physician in the practice, and that practice could help communicate you mentioned the wellness or rehab program being instrumental to having a world-class CV program, and, the cost and quality data that play into that. But it's really, again, goes back to your original comments about patient-centric. All of these things are being put in place to collaborate to support the patient, and that quadruple aim. And I wonder, what did your employees and what did the employees feel were, good aspects of that, changing that process? And what did you hear from patients after you put those new things in place?
Yeah, so I think initially that there's pushback. There's pushback on both sides because they're doing what they believe works for them. Again, not maybe thinking they've made a patient-centric process, but really it's a very disjointed process. So oftentimes early on, and even for a while, you have pushback in both teams trying to merge, that old forming, storming, norming, performing thing. But once they understand that this really may make things easier for all of us, having somebody from the practice side come and work on the hospital side, and somebody from the hospital going and working on the practice side, they begin to understand how they can make things work and put the patient back in the center. And patients, once you remove those barriers, it's very confusing for patients if they're hearing different things from different people. Mm-hmm. Who do they trust? Who is the source of truth in terms of what I need to do or what's going to happen to me? It's a huge satisfier for patients.
And so, how were they impacted? What did you hear after putting this in place?
Yeah. So shorter wait times. Fewer delays around medications that should or should not have been taken the morning of a procedure. If there's confusion there, the patient may have to wait an entire day, and rather than, they arrive at 5 a.m. and rather than going to the lab at 7 a.m. or 8 a.m., now they have to wait until 6 p.m. So obviously that's a big satisfier for them. But many times they don't even really know that. Mm-hmm. They only know what's happening to them. So their experience is related to what happens when they get to the hospital and how they feel when they leave the hospital, and then when they get back to the practice. And, if we've made that easy for them rather than difficult, it has a huge impact. And I think it plays and can play a huge role, obviously, in what your patient satisfaction scores are.
I'm sure. This has been a wonderful conversation, and I love how
I've enjoyed
the
it.
focus is on this collaborative effort. So all of the things tie together with that. And I thought we'd leave listeners with your advice for members who are developing or considering these shared governance and co-management and all these different collaborative kind of approaches. What's your best advice for them as they move through that process?
Well, I think you have to be a leader in moving collaborative thinking forward. Ask for data. If you don't have data, ask for it. It's there. There's tons of data. There's tons of data on the practice side. There's tons of data on the hospital side. We need to ask for it, and you may get it and not understand it. Then it's time to ask for a team meeting to discuss it, so that we all understand it, and nothing's secret in the data. It is what it is. Data tells the truth. If no one has already done it, take the first step toward creating a shared governance structure. I think first at the highest level of the service line, there has to be commitment from the leadership to sit down together and create a vision for the program. socialize that concept and be persistent in moving it forward. And if you hit a roadblock and you absolutely can't move or you need help, there's lots of resources in the industry out there, like the MedAxiom consulting team and other things, other sources to facilitate moving it forward.
Terri, great thoughts. Great.
Thank you.
Love knowing your why. Great passion. And it was wonderful to talk with you today. Really appreciate you being on MedAxiom Heart Talk.
Thanks so much, Cheryl. I enjoyed it.
That's it for this episode of MedAxiom Heart Talk. We'll put a link to Terri's blog and bio in the show notes. And if you liked today's episode, please listen to us next time and tell your colleagues. If you'd like to give us feedback directly or make a suggestion about future guests or topics, email us at hearttalk@medaxiom.com. And don't forget to subscribe to MedAxiom Heart Talk wherever you listen to podcasts.